independent commissions. Your Excellency, I'm honored to present to IBEC the status of our transition to social health authority and our progress towards universal health coverage. As we convene here today, our mission remains to deliver Bima Bora Afya Nyumbani for every Kenyan. And I'm pleased to report that Taifa Care Initiative has gained immense traction. Between October of 2024 and 11th February 2026, we have registered 29.4 million Kenyans. Financially, the fund is robust. We have collected a total of 142 billion across all the funds. Critically, for the counties represented here, we have disbursed 102.3 billion to healthcare providers in order to ensure service continuity. Access to service is expanding daily, Your Excellency. 8.08 million Kenyans have utilized the primary healthcare fund, while another 3.2 million Kenyans have accessed the specialized care under the Social Health Insurance Fund. Excellencies, a primary concern for this council is the liquidity of county facilities. And the data that I have presented confirms that funds are effectively moving to our grassroots facilities. Under the primary healthcare fund, for example, we have paid 13.3 billion, with 57% of that going directly to our county public health facilities. And I wish to specifically commend the top performing counties that have maximized the utilization of these funds. Nairobi leads with a pack, having received 1.34 billion. Kiambu follows with 754 million. Mombasa has received 597 million. Kakamega and Bungoma round up the top 5, receiving 556 and 455 million respectively. Under the Social Health Insurance Fund, where we have paid out over 84.6 billion, the leaders are Nakuru with 1.4 billion, Homa Bay with 1.29 billion, and this demonstrates the facilities which get their documentations right are seeing significant revenue. A critical pillar of UHC, Excellencies, is to ensure no one is left behind. And we have seen exemplary leadership from our counties stepping up to sponsor their vulnerable households. And I want to officially recognize, Your Excellency, the Deputy President, that counties that have paid their pledges and are actively supporting the most vulnerable people among our communities are Murang'a County, that paid 171 million, covering over 107 households. Trans Nzoia County, 23 million for 2,178 households. Migori County paid 5.6 million for 4,800 households. Mombasa County paid 3.6 million for 1,045 households. We also want to acknowledge the pledges that we have currently have, which are under validation from Kisumu County, Baringo, Nandi, Lamu, and Uasin Gishu. And I urge these counties to expedite the payments so that their indigents or their vulnerable residents can start accessing the benefits immediately. Your Excellency, we are steadfast in our commitment to maternal health. Since October 2024, the Social Health Authority has facilitated 583,298 normal deliveries and 326,684 cesarean section across the country. To ensure that we fully support the grassroots, we have identified a specific need for level 2 and 3 government and faith-based facilities. And as per the direction of the summit chaired by the President, we estimated a budget requirement of 2.04 billion to effectively kickstart and sustain free maternity service at these levels. We have already engaged the National Treasury to seek this specific allocation, ensuring that our dispensaries and health centers in far-flung areas are not left behind, and our mothers and women will not walk long distance looking for a facility where they can deliver. And the National Treasury has confirmed to us that they will put it in the supplementary. Simultaneously, we are addressing the unique needs of young mothers through the Teenage Mothers Program. We have registered 48,273 teenage mothers nationally. The counties leading in this charge are Bungoma with 4,037 registration, Kakamega with 2,950, Meru with 2,807, and Kisii with 2,532. On the Public Officers Medical Scheme Fund, I am pleased to report that the scheme has grown significantly. We have successfully onboarded all civil servants under the Public Service Commission, and effective 1st of December 2025, all the teachers, 415,000 teachers in our country, are now served under the Social Health Authority. I call upon all our county governments, Your Excellency, to follow the example of Vihiga and Nairobi counties by onboarding your employees onto the Public Officers Medical Service Scheme Fund. This will not only cover your staff, but also will boost our revenue streams of your county facilities where they will seek medical care. On infrastructure, Your Excellency, through the National Equipment Service Program, we have installed equipment worth 6.18 billion in 126 facilities across the country. Today you go to Lamu, King Fahd, one of the far-flung counties, you will find a CT scan, you will find a complete theater, and you will find a pediatric wing with oxygen that reduces the travel for Kenya to go and seek referral facilities or referral treatment in our level 6. I urge governors to sign the next addendums in order for us to operationalize the funds for maintaining these equipments. Finally, regarding the implementation challenges, Your Excellency, we have deployed county clinics, joint teams from MOH and SHA and DHA are visiting counties to resolve claims and system issues on the ground. So far, we have visited Kisii, Kisumu, Mombasa, Mandera, Embu, and makwiny. And this goes also for the faith-based and the private hospitals, so that any issues on how to lodge your claim, on how to deal with our digital superhighway, these clinics will help us resolve. And I want to single out Kenyatta National Hospital, Nakuru Referral Hospital as one of the, and Mombasa as one of the counties and referral hospitals that have done extremely well in making sure that their claim system is right and there are no rejections. Your Excellency, to conclude, I place the following urgent request before this council. Number one, correct bank details. I urge the governors, our governors, to instruct their county health CECs for finance, both health and finance, to provide us with accurate, verifiable details for over 1,287 health facilities immediately. We want to clear these payments by the end of this month. These facilities, mainly in our counties, over 1,000, we cannot pay them. We have their money because we can't pay them because of the details that they have provided are not correct when we check with the bank. So we really want that immediately resolved through the chair of the Council of Governors and the Secretariat. Two, we really want the county government to sign the National Equipment Support Program addendums, and I urge governors to facilitate the signing of these addendums for facilities where equipment is installed. This will unlock the flow of funds for equipment maintenance. Third, we urge the Council to fully implement the Facility Improvement Act. Revenue retained by facilities must be treated as an addition to, not to a replacement for the equitable share in the health sector. And fourth and last, we want counties to support us in the programs for helping the indigents in our country. We request more counties to follow the example of Murang'a and Mombasa in identifying and paying premiums for the indigents to ensure that no one is left behind. With your support in resolving these administrative and compliance hurdles, we will deliver a healthcare system that is accessible, affordable, and dignified for our people. Your Excellency, that is a brief. The document presentation is available. We will give it to the Council of Governors. We have county by county what we have paid, what is outstanding, what they're supposed to do, and we can share that with the Secretariat. But this is just a brief of our presentation. I really also want to thank the 10 counties in terms of registration. The county of Mombasa, Nyeri, Bomet, Elgeyo Marakwet, Kirinyaga, Tharaka Nithi, name it, the 10 top, who are now at an average of between 65 to 71. I really want to thank them because they're counties that are doing very well, and I really urge the ones which are at the bottom to make sure that they catch up with their colleagues. Thank you very much, Your Excellency.
Thank you, Waziri. A round of applause for CS Duale. Thank you very much for that very clear presentation. We now want to find out what the feedback is from the plenary. That's what Waziri Duale has said. Chairman Abdullahi.
Yeah, Your Excellency, I want to present a short report here in rejoinder on behalf of Governor Abdul Samad Sharif Nasir, who is our Chair of Health and who, because of other exigencies, could not be here. We take note of everything that the CS has said and presented. Excellency, SHA has been operational since October 2024, and we reiterate the county government's commitment, which has really been consistent in support of SHA, in change management adaptations, and in championing registration and aligning to the new health information systems across facilities. However, there still persists certain challenges which we have previously raised. We appreciate the position that this is not a technical working group discussion, but we just want to highlight from the Council's perspective what these challenges continue to be. Number one, unpredictable payment of PHC and SHIF funds. Though there was a commitment to pay by the 14th of every month, it's not happening, and especially for PHC, some of the counties have not received their funding